So next we have Dr. Virendra sir presenting on clinical profile and predisposing factors for recurrent idiopathic intracranial hypertension.
Yeah. Thank you everyone, and thank you AOS for giving me the opportunity to present this work titled Clinical Profile, Outcome and Risk Factors in Recurrent IAH. So yeah. So while we all know that idiopathic intracranial hypertension commonly presents with blurred vision, headache, and at times with diplopia, and is commonly affects young to middle-aged women more commonly than men, and majority of patients are obese. What is also known is that majority of patients tend to have good resolution with compliant therapy in majority of cases, but there is a very limited data regarding the recurrence in IAH. So according to a prior study, Rowe et al. Studied patients over a period of 6.2 years, and they found that about 38% of them did develop a recurrence. So with this intention to look at a cohort of patients from our own settings, we tried to identify patients who had a recurrent IH. We wanted to find out in how many cases it recurs. We studied the demography and clinical profile, visual outcomes, any predisposing risk factors for the recurrence. So it was a retrospective study including patients from January 1, 2016 to March 30th, 2021. We took prior approval from ethics committee and followed the ethical guidelines. Data was collected regarding the patient clinical profile, demographics, laterality, visual function, radiological changes of IH, number of recurrences, optic disc morphology, and what type of medical treatment had been given. Appropriate statistical analysis was attempted using Stata software. So coming to the results in brief, we found a recurrence developing in 41 out of the 449 patients that we identified during this period. That means 9% or 1 out of 11 patients with IH can go on to develop a recurrence, which means that it is not very uncommon. As regards the demographics, the patients were 87% of them were women, and median age was around 35 years. So coming to the presenting complaints of these patients, about 50% of patients had headache as a presenting complaint, and about 45% of them had blurring of vision as the main complaint. Vomiting and diplopia was seen in a minority of patients. If we look at the optic disc findings, majority of them, over 75%, had grade 2 or 3 disc edema. So that means it is not difficult to pick up the recurrence occurring, because majority of them have well established papilledema at presentation. If we look at the visual function of these patients, despite having significant disc edema, majority of them had a restricted visual acuity of 20/25 or better in majority of cases. And if we look at the visual fields, majority of them had a mild to moderate visual field loss with median mean deviation of about 6.3 decibels. Majority of the patients again had enlargement of blind spot, which is the classical field defect that we see in established papilledema at presentation. Importantly, we try to look at the systemic comorbidities and BMI of patients. We found that anemia was noted in about 30% of patients with recurrent IAH, followed by hypothyroidism. Rest all, such as PSCOD, systemic hypertension, diabetes, were seen in isolated cases. If you look at the data about the weight at the presentation of recurrence, the data was available from about 19 patients, and majority of the patients did have overweight or a obese category. The median CSF opening pressure was 35, which means it was pretty elevated. We also looked at the radiological findings, and we found that sinus hypoplasia was noted in 10 out of 41 patients. That means 1 out of 4 tend to have a sinus hypoplasia, and in majority of cases it was transverse sinus hypoplasia. Majority of patients had only one episode of recurrence. As regards the treatment, the patients in the first episode had been treated with medical management in majority. Only 3 had undergone a shunt surgery. And none of the patients who underwent shunt surgery went on to have a recurrence in this setting. So majority of the patients were managed by medical therapy. If we look at the final visual outcome of these patients, they tended to have a very good visual outcome in majority, with significant improvement in visual acuity and visual fields. We try to compare these patients as compared to the IH representative group who had first episode, and we found that there was no significant difference in terms of age, gender, and BMI. We also try to look at the systemic risk factors. As I said before, anemia was noted to be a very significant risk factor in patients who had recurrent IIH, and the visual field differences was noted in the terms that none of the patients with recurrent IIH presented with an advanced field defect, whereas there were few eyes who had advanced field defect at primary presentation. The clinical characteristics were not different. The logistic regression analysis showed increased risk of recurrence with sinus hypoplasia and anemia. So coming to the strengths and limitations, it's a fairly large series of patients with recurrent IH, given it occurs in only about 9% of patients. However, we had lack of uniform data about weight, anemia and risk factor at each follow-up. Though now we do prospectively for all patients, it was not there previously. Many patients did have short follow-up and longitudinal outcomes could not be assessed. So in conclusion, recurrence might occur in patients who are women. The majority of patients do tend to have good visual outcome with timely treatment. Transverse hypoplasia and anemia could be associated with increased risk of recurrence. However, more studies are needed to confirm this. Thank you. These are my references.
Well documented, sir. Only thing is, exceeded your time.
Yes.
Here I would like to have some clarification. Which sinus is hypoplasia, and on that, you give any idea about the speaker?
Yes. So transverse sinus was hypoplastic in 9 out of the 10 patients, and it can be seen in otherwise in commonly also, like about 25% of the patients tend to have one side as dominant. So that's why it is difficult to prove without having a bigger study whether this is really contributory or not. At this point of time, this is an association we have found, and we would like to test it with larger multicentric studies.
Can you say one word to the youngsters that whenever you see MR angio, try to see the transverse sinus hypoplasia and try to have a cautious about it. Is it going to help them?
Yes, sir. MR venogram, look carefully for the signs of hypoplasia.
So signs of hypoplasia on a transverse sinus is going to help you and giving you some sort of insight to identify these patients developing this problem. So you try to be very careful about and identify that whenever you see a MR angio.
Yes, and also like correct anemia and prevent recurrence of weight gain. Thank you.
Thank you, sir.
So data was there. We did saw in about 20% of patients they might have coexisting abnormality. However, as per prior literature, there is no correlation.
Use the phone. You may use the microphone.
Yeah, they were our own. No, the first episode was treated by us. I think about 90% of them have been treated by us previously. However, there are about 10% of patients who have been treated elsewhere also, and they have come to us. We had records. All the patients are like those who have been treated. Disc edema has been documented to be resolved, and then they have come back with a problem.
Thank you, sir. We're going on to the next one.